Hi ladies! Did you hear about these scary words?
Diastasis recti.
Yes? Alright, if not, well, I'm about to explain you why you might want to look into it and act now to avoid suffering from it. So stay tuned. I'm Leslie Abraham, the founder of Bonjour Baby. I offer online holistic coaching to prepare pregnant women like you for childbirth. I put together this program after helping pregnant women for more than 10 years as a DO and personal trainer. At the end of this video, I'll share with you some pregnancy safe core exercises, so stay there. Alright, so first, a quick word on diastasis recti. If you don't know what it is, it's a separation of the muscles called the rectus abdominis, the six-pack muscles, if you will. The stretching of the center line here, called the linea alba, happens naturally during your pregnancy. A little human is growing inside of you, and so is the uterus. It will gain in volume and your belly is growing. As it is getting bigger and bigger, it pulls on your fascia, muscles, ligaments, tendons, and skin. And if you don't learn how to engage your core muscles properly during your pregnancy, well, this separation can be problematic after you gave birth. Let me show you how to measure it. So lie on your back, place 2 fingers just 1 inch above your belly button, then lift your head gently. As soon as you feel your fingers sinking down, try to feel the quality of the tissues. Is it tonic? Is it smooth? Is it wider than 2 fingers? If it is wider, you have what we call diastasis recti. If it is less, it's physiologically normal after pregnancy, but there is still some work that needs to be done to close that gap. The quality of the tissues is as important as the width of the separation. So if it is too smooth, it needs to be addressed too. So now, why is this important? Diastasis recti could impede you from doing a lot of movement when you exercise and in your daily life. It's not safe anymore. For example, planks, push-ups, core exercises like sit-ups and crunches, downward-facing moves, or any movement placing too much stress on your core muscles are a no-go. But this is where it gets tricky. If your core muscles are not strong enough or lack integrity, any other movement will be challenging for your body. This area of your body is the basis of any movement that you do with your upper body or lower body. Something as simple as walking can be altered by a lack of integrity in this area. And you might develop any kind of pains and weaknesses in different places. Now, I hope you understand the importance of a good core connection. I told you I was about to share with you 3 tips today. But first, if you want a free prenatal workout and nutrition guide, just over there, download your freebie. You'll find the link just below this video. Tip number 1, watch your posture, ladies. I know, your mom probably told that all your life, but guess what? Like a lot of things, she was actually right. Pregnancy is shifting your whole posture from that to that. You can see in the last picture that the core muscles are totally disengaged and everything relies on your back muscles. That's just the best posture if you want to suffer from sciatica during your whole pregnancy. To check your posture, you can do so. Stand in front of a wall and see if your butt, your mid-back between your shoulder blades, the back of your head, as well as your heels are touching it. If not, try to adjust yourself and find a comfortable spot. Stay there and breathe gently. Avoid letting your lower ribs flaring out. Now, to help you even more, you can work on your posture with simple drills like holding a weight while you walk. It will help a lot. Tip number 2, don't forget to breathe. If you breathe following my method, you will engage and activate your core and even your pelvic floor muscles safely. Breathing properly means engaging this deep muscle in your abdomen and starting breathing from your pelvic floor up to your diaphragm, not reverse. Your shoulders and upper thorax stay as quiet as possible. Place your focus on breathing out rather than breathing in. Breathing in should happen naturally and breathing out should be more focused first on your pelvic floor and then moving up to your diaphragm while engaging your deeper core muscles. Tip number 3, are the Holy Kegels. But watch out, ladies. There is a way to do Kegels properly. First, stop doing them when you go peeing. The only thing you'll probably get from it is a UTI. Not good. Start sitting on the edge of a chair, watching your posture. Breathe in through the nose, feeling your belly expanding. Breathe out through the mouth and engage your pelvic floor up. Imagine you want to stop the flow of urine. Breathe in again, breathe out, and now engage the back part of your pelvic floor muscle. For that, imagine you want to stop gas passing by, but don't squeeze your butt. It's a more subtle kind of contraction, more deeper. Then once you're comfortable with this, you can combine the front and back muscles when you work on your pelvic floor exercises. You can do it while you watch TV or when you're working out as a rest, seated on an exercise ball. You can do it slow at first, then try to do it as pulses. If you're consistent during your pregnancy, it will really ensure this core pelvic floor connection that will prevent diastasis recti. I promise you. So if you have any question or are just interested in knowing more, comment bonjour in the comments below. Now, I told you I will share some prenatal safe core exercises today with you. You can check that video just over there for some of my favorite core exercises. And if you haven't downloaded it yet, go ahead and check out my free prenatal workout and nutrition guide just here. Here it is for today, ladies. I hope you like this video and that you understand that you can implement these super easy tips in your daily life to prevent diastasis recti. If so, let me know by giving me a like and subscribe to my channel. Do not miss any videos. Future videos are coming every Tuesday, so stay up to date by clicking on the bell. You might want to check out this other video just over there. I'll see you later, ladies. À bientôt.